everyone, my name's Callie, and I chose Generalized Anxiety Disorder for my psychopathology paper. I didn't want to take a video of myself, so I decided you guys could look at this picture while I talk. I chose this topic because it is very prevalent in my family, and I wanted to learn more about this disorder so I could pass the information to them. I also struggle with anxiety, and as I grow older, it would help to learn more information so it does not affect my successful aging process. So what is generalized anxiety disorder? According to the Mayo Clinic, it is excessive ongoing anxiety and worry that are difficult to control and interfere with day-to-day activities. I remember from a previous psych class I've taken that the professor said everyone has anxiety and stress, but when it starts to become debilitating and affecting your everyday functioning, that is when there's a problem. Symptoms include persistent worrying or anxiety about a number of areas that are out of proportion to the impact of the event, overthinking plans and solutions to all possible worst-case outcomes, perceiving situations and events as threatening even when they are not, difficulty handling uncertainty, indecisiveness and fear of making the wrong decision, inability to set aside or let go of a worry, inability to relax, feeling restless, and feeling keyed up or on edge, difficulty concentrating, or the feeling that your mind simply goes blank. Physical symptoms include fatigue, trouble sleeping, music tension, muscle tension or muscle aches, trembling, feeling twitchy, nervousness, or being easily startled, sweating, nausea, diarrhea, or irritable bowel syndrome, also irritability. Etiology includes differences in brain chemistry and function, genetics, differences in the way threats are perceived, development, and personality. So prevalence cross-culturally. Before I researched the prevalence cross-culturally, I thought to myself, well, I bet America has the highest rates of anxiety because we were such an on-the-go type of people and we want to be perfect, that anxiety is very prevalent. So I was right, and according to the Anxiety and Depressive Association of America, highest rates are found in the United States. Generalized anxiety disorder commonly goes undertreated in developing countries, and in America, 40 million Americans over the age of 18 are affected by anxiety, so roughly 18% of the nation's population. Common treatment, according to an article from the Harvard Health Publishing and Harvard Medical School, elderly patients with generalized anxiety disorder tend to experience more physical symptoms and less intense emotional disruption. Drugs may not be the best choice for elder patients because they are more prone to side effects. Cognitive behavioral therapy is a good first-line psychotherapy for treating generalized anxiety disorder in the elderly. Relaxation techniques such as exercising and deep breathing, coping skills such as engaging in hobbies. Age-related changes in the absorption and metabolism of drugs tend to make drugs linger longer in the body, increasing the risk for harmful effects in elder patients, even at doses considered safe for young people. Older adults also are more likely to use a variety of medications, and some of these drugs may interact with anxiety medications. Prescriptions for anxiety in the elderly may include Buspar, antidepressants such as Laxapro, Paxil, Valium, Ativan, or Xanax. So how does this disorder impact life for an older adult? Sleep, participation in social events. For example, patients I work with in the nursing home that have anxiety never want to leave their room and go to the recreational therapy activities, and they require a lot of encouragement to engage. Someone might miss family events or grandchildren events because of their anxiety. It might inhibit them to learn a new hobby or skill. It could increase with the loss of a spouse and inhibit the person to use their coping skills and relaxation techniques. And it can increase physical pain, such as arthritis. Thank you very much.